Any questions? I'm open to it.
Doctor, very nice presentation.
Thank you.
Can you hear me?
Yes, I can hear you. Please go on, sir.
Yeah. So the thing is, there has been so much of write-ups or videos on the YouTube, etc., and the social media, as you mentioned. And the main reason for the people to think of reversal are leaving the tablets and trying to achieve natural, ways and means to control the sugar is the fear of side effects of the tablets. If that is taken care, and if you give some kind of advice or what kind of damage the tablets can create, that there's a fear of creating a lot of complications due to the adverse drug reaction or side effects of the drugs. That's the only worry, because people are trying to do these kind of things.
Can I just explain?
If the drugs are safe, if you give some assurance that drugs are safe, you can take these drugs for lifelong, I don't think people will try to venture into that. That's my question.
Sir, I'll explain it differently to you, sir. There's no point getting into a lot of medical things about this. I can talk about side effect. I can talk about drug therapy and all. I'll tell you in simple terms. About 2-3 decades ago, the life expectancy was India was about 60. Okay, and beyond 60 was considered to be old age. Now, the number one disease, non-communicable disease in India today is diabetes. Now, with therapy, if the treatment was so bad, if people had to have so many complications and side effects like it is being claimed, how come today a diabetic is living to 80 and the actual life expectancy of India is gone beyond 72 in the last census itself? Anybody with diabetes can expect to touch 80. So if things are going so wrong as is being claimed, how do you account for the fact that the life expectancy of Indians is booming? Yeah, I shouldn't explain this using medical terms. I should explain with statistics so that you and me understand. Okay, so that is one. I do not deny that there are medicines being used by some doctors somewhere, because we are churning out doctors without quality control for many years. Now the controls are slowly coming into place. But if you see 2-3 decades ago, it was just churning out and there was a problem there, and we cannot really undo everything. But compared to UK and other places, you just imagine you get a heart attack after 1 week. If you survive, then 6 months later, you get an angiogram date. Today, you are in India where you can have a heart attack and you can get reversed in about, I'm talking about a heart block. We can melt the clot, and by next morning, the angiogram is done. A life is saved within 3 days. Okay, even a bypass surgery, after 7 days, you are discharged. Where in the world is this happening? Except for the big shots who have all the money in US, even there the healthcare has not touched what India has touched. So you just need to find a good doctor, family doctor who will guide you. That's what's lacking. You get one trusted doctor for your family, everything else will fall into place.
So my name is Anand.
Thank you.
Sir, can I ask you a question? I am from Guwahati.
Yes, sir.
Sir, my question is, now there are many programs are going on regarding this reversal of sugar by diet, and that by taking that diet, the sugar goes down drastically and the medicine is also reduced.
So sugar can go up in endocrine diseases, many diseases. I suppose you're talking about adult diabetes.
Yeah. The person who are taking insulin after taking the diet program, their insulin is removed and they are on medicines. So, and the sugar level also decreasing. So, whether it is sustainable or not.
Okay.
And what is the way forward of your program? What is the program you have which you will give to the patients?
Yes, sir.
This is my second question.
No doctor who knows diabetes will tell you to take tablets first. Let me make it very clear. The first step is we'll counsel for weight loss. We'll talk about diet. My grouse is that traditional diets are not being followed. Okay, Assam, you should follow Assamese diet. You should have a dietitian there who gives you a Assam-based calorie according to your body weight. We calculate how much you require, basic minimum. Okay, so that is two. And the third thing is they go in for exercise program as well. So these things are not new. It never came in the last 5 years. It's been there for 40 years. Now the thing is, it's being made to look like only medicines are being given and these things are not being done, which I hope is not there in the prevalent in rural areas. Okay, but here in the city, at least I can tell you, the first thing starts with a diabetic diet chart, then only progresses to the other areas. So it's not that the nutrition is not being followed. But let me give you an example for you to understand this. Suppose I buy a car and the engine is having a problem, okay, engine kharab. So it starts leaking petrol. The solution is not to cut the petrol. I cannot tell you, you cut down your daily requirement of food, completely starve, I'll bring your sugar under control. That will do more damage to the car. The whole car itself will stop running. The idea is to give the daily requirement of petrol to the car and repair the engine. Okay, and to repair the engine, if you get a bad mechanic, he'll overdo it and he'll overcharge you and he'll do a whole lot of things. The same thing I'm applying to human beings as well. If you don't get a bad mechanic, you get a good trusted mechanic who's done all your cars, taken care of it from the time from your father's time to your time, it's unlikely you'll go wrong. Have I answered your question in an indirect way, sir?
So I want to ask you, what is your therapy? Whether it is a diet plus medicine or it's only diet therapy?
Okay. Like I told you in my slide, I don't know whether you joined in the beginning, sugar control is important, but it's not as important as a person living without complications up to a ripe old age. Okay, the goal of cardio diabetes is not sugar control. The goal of cardio diabetes is to live beyond 80 without complications. Some we can achieve it, some we can half achieve it, some we not. So the idea of sugar control around being diabetes is completely upside down actually. Okay,
what is your
not the sugar alone.
What is your therapy and how we will be able to get the benefit from a remote place like I am in Guwahati? How I will get?
Okay, sir. Let me put it differently. The early stage, we won't use tablets. We'll only give you diet and walking, exercise and all that. That will go on for some years. And if you do it properly and don't put on a paunch, don't put on fat around the middle part of your body, and you don't gain weight, many people live without tablets. Okay, that even doctors or diabetologists know that. The second stage is when the sugar, despite doing all this good lifestyle changes, it peeps out. The sugar is saying, okay, this alone is not enough. Then judiciously we use the lowest medicine. Then after 5 years, go to middle medicine, then to higher medicine. But some people will have a very aggressive lifestyle. Okay, they may be in trading, they may be in finance, they may be in morning to night high stress job. For them, the curve goes faster, so we need to chase behind the sugar. I'm talking about sugar now. Sometimes you get a complication. Now, tablets, see, like in ICU or during a surgery or during pregnancy, a tablet can decrease the sugar. It cannot prevent your complication. It does not do a repair job, which God-given insulin in your body does, which is why we replicate insulin when necessary. Sometimes it's temporary, but if your tablets are completely not working and there is no insulin left in your body, we have to replace it from outside. So there are 4 categories and you have to use it. Different patients will have different requirements. There's no one formula for this.
So what is your package and how you treat the people?
That you call SafeGuard family. So this is about giving, imparting knowledge to everybody about this new topic which is going around in the social media. My job is to clear all your doubts, make you feel comfortable. You can go to SafeGuard family on the internet. They tell you about the program.
Okay.
Sir, my name is Anand.
Hello, sir.
Please.
So I have a question. So again, we're seeing a lot of, as you said, on the social media, the reversal program, and there are many brands around that. So I happen to attend one of them as well, where they claim to say that over a period of time, again, I'm just repeating what I heard, that, the beta cells rejuvenation will happen after a year of going through the treatment because of the kind of metabolism which will get repaired as part of the program, and hence the reversal. But nevertheless, since you're already had once and susceptible, again, you have to maintain the kind of lifestyle, everything that as you go, as you are advised as part of the program. So what's your, because what they say is that once the beta cell rejuvenation happens, it's more or less taken care. But here I see that, there's nothing like reversal, it's only remission. So
this beta cell rejuvenation has been there for decades. How do you think this person was taking so many tablets? The slide I'm showing you, I hope you can see the slide, sir.
I can see.
When he lost weight, he decreased his tablet, which means there is rejuvenation happening. This article was published in 2011. Now, if I go a little bit behind it, okay, the world's longest trials running for more than the first 10 years before 1993, they started the trial. And they said it reduces the risk. There is benefits to controlling all your complications into decreasing sugar and all that due to lifestyle, that is nutrition and all that. So the rejuvenation is what they're talking about. It's not something that is you heard about it today, but this has been going on since 1993. Proof has been published, world trials all over the world. So what I'm trying to tell you is now repackaging and remarketing is happening. If you go to a right doctor, he knows all that you're telling me. It's basic ABC for us.
Okay.
Understand, sir? This rejuvenation of islet cells in the pancreas is basic foundation level class which we take for MBBS students. It's not something, it's being projected as something new, and we will do it if you come to us. That's the difference.
Okay. So, but just a follow up on that. So, if the rejuvenation happens, is it not going to kind of address the issue, or what exactly?
I'll tell you about one patient I have, sir. He was really huge, young man, really huge, and he had crossed all the tablets. He couldn't bring the sugar under control, but he didn't have really any major complication as such. So we said we just fly under the radar. Let your sugar be slightly on the higher side. Plus, he loves his drink a little bit. And, he basically grown up, pampered, and he couldn't change his lifestyle. Then when he started having tingling and all that in the feet, we told him, see, this is the first sign that the nerves are getting affected, okay? So then he got scared. He wants to enjoy his life further. So I know this person, he went to his club and he started swimming. He came back about 3, 4, I don't remember the exact months. A few months later, he came back really looking, slim and nice and trim. Okay, and we took him off his tablet one by one as he lost weight and as he started his exercise, which means once you change your lifestyle, rejuvenation can happen. This happened 10 years ago.
Okay.
So what I'm saying right now is there are top doctors in whichever state you are, whichever town you are or city you are. All you need to do is somebody who can guide you to the right destination. Don't fall for marketing gimmicks, because this is what happened in the term reversal of heart disease. I'm a bit scared because I was one of the medical directors of the Dean Ornish program, reversal of heart disease. And it got appalling to a stage. They said, leave all your tablets, and many people were affected. Who's going to answer that family? So it cannot be reaching a stage of it cannot be reaching a stage of irresponsibility. You cannot have melas and camps. If you can prove rejuvenation with only diet for more than 10 years. Okay, I'm not talking about the first pre-diabetic and early diabetic stage. Please publish it. Let the doctors read. See, you got to understand one thing. Our doctors taught, when you make a claim with proof and you publish it, 6 countries have to reproduce this. The same thing which you did, they will do it in their thing and they will reproduce, like what we did in the cholesterol block and anti-cholesterol medicine. Then only they published the book Reversal of Heart Disease. So after all these 6 countries say, yes, it is peer reviewed, then it gets into medical textbook, not sitting in 5-star hotels and having claims and promising, come and join our program, we'll do something for you. So that's the caution I'm trying to highlight here.
Okay.
Hello, doctor.
Yes, please.
Hello. I have a quick question. So if you're pre-diabetic, can you not control with diet and exercise, and do you really have to go the medicine way?
No, some people can be pre-diabetic for 5 years. Some people can be pre-diabetic for 10, 15 years. let me put it differently. Suppose a person has got MYDY diabetes, okay, which is was a type of adult diabetes, maturity onset, okay. Adult person gets it, but at a younger age. This kind of diabetes, many people put, the starting tablet metformin after putting on a diet and a walking and everything put together. Sometimes we remove the tablet and the sugar is still under control. So there is not one, the diabetes is not one disease. Why is MODY not diagnosed so easily in India? Is because if I'm sitting in some village somewhere, I need to treat my patients. But this is a genetic disease. I can't take blood and send it to Boston to find out that he's got a genetic defect which is causing MODY diabetes. So doctors know how to play the game in the village as well as in corporate hospital and abroad.
So is
put
it not that
together,
metformin is
a doctor
described
will tell
only
you what
when,
type of diabetes.
is it not that metformin is prescribed only when you are actually diabetic, but you're prescribed sitagliptin or something when in the pre-diabetic stage? Does it
No,
have
ma'am,
any
you're
long-term
talking-
effect on the health?
I suppose you're talking about type 2 adult diabetes, which comes on with age.
Right.
Okay, in this category, it is very, very clear. Stage 1 is diet control. Stage 2 is exercise. Stage 3 is weight loss. When all these things have failed to control sugar, and if there are no other complications, you can use metformin. But if there are some complications, sometimes we choose not to use metformin and we go for some other class of medicine. See, some people might have a weak liver, a fatty liver or something, or a weak liver. Some people might have a weak kidney. So the choice of medicine depends on a complex amount of factors. It's not one-on-one kind of a formula.
So does it make sense to stop the medication gradually once everything else is under control?
Ma'am, I have to go very deep into this subject. Metformin actually
No, I'm not
increases
talking
your
about
digestion.
metformin.
I'm just
because
telling it
I
very
want-
easily.
Okay.
Metformin is not a tablet that pulls down your sugar. It doesn't bring down your sugar. It increases your digestion power. I'm just putting it very bluntly so that you understand.
Okay.
So by stopping metformin, you're not going to have a very earth-shattering difference in your sugar values. But keeping it under control through doing your food, not during your food, during sleep, all put together, it's a good start medicine. So just by sugar stopping metformin, not stopping metformin is not an argument at all. I need your blood vessels not to have deposits even when you're sleeping in the night.
Okay.
So sugar is only one component, not developing complications. I would definitely give metformin if there's even the slightest risk, which is far away I can see, which may affect my patient. Why will I allow it to affect my patient? Sugar may be normal.
Got it.
So
It's
not just one thing, ma'am. It's a complex decision. That's why I said it's a group of factors that you have to take into account.
Got it.
Hmm?
Thank you.
If anybody is telling you sugar is the end all of the treatment of diabetes, it's absolutely wrong.
Okay.
Hello, sir. Good evening.
Yes, sir. Good evening.
Sir, good evening, sir. Sir, actually, I recently got with infected with the COVID, and then afterwards it was in mild. I had already vaccinated, but after that one, I felt like that I'm having a pre-diabetic. So I go for the test, and it showed me the result says 158, and HbA1c was about 6.8, like that. And like, sir, my question is that is there any relation between COVID and the diabetic? That's one question.
Okay.
And second one is about as you mentioned about the stages. So do we have anything like readings, like fasting, how much, when we should go for the medicines in that period?
Okay. Let me put it differently, sir.
Yes, sir.
Now, COVID is a new virus. We've not seen it before this. Okay, it's come new into the world. It's mutating and taking many forms.
Yes,
Okay,
sir.
today it's green, tomorrow it's yellow, day after tomorrow it's red, and nature is playing out. And doctors are not scientists. We are supposed to follow guidelines given by scientific bodies. I'm not sitting in my clinic doing research. So if you get any social media messages saying that COVID causes diabetes, it's only a theory. But whether COVID can uncover a diabetes which is already lying dormant in your body, genetically a father, mother may be a diabetic, definitely there are reports saying that COVID opens out and brings out the sugar in a diabetic patient if he already has pre-diabetes earlier. So that is one. Second is, without even touching you, sitting here online and giving you consultation is the wrong thing to do. Whichever part of the country you are, your doctor next to you may be more brilliant than me. So please take his advice. Don't suppose that because I'm giving a webinar, I'm sitting far away and telling you everything about diabetes, I am the sole authority. So either it is not correct giving online consultation, please see the expert next to you. He'll guide you.
Exactly. Thanks, sir. Sir, regarding when we are going for the self-testing through glucometer, and there is also the testing done by the lab, there is a lot of variations come down. So do I have any guidelines? Because
in India, we are very good at buying, if you tell a patient go and do exercise, they'll see the TV and buy a cycle, costliest treadmill, everything costliest, but they won't walk. The same way, we buy a glucometer, but we don't know how to store it. Now they'll buy the glucometer, keep it in a drawer where the heat during the summer changes the chemical inside. Okay. So without knowing, without reading the fine print saying that it has to be kept, in a cool place, less than 25 degrees, and there's an expiry date, all this kind of thing. And some people use the wrong stick. They use AccuCheck stick for some other company, and they use some other company for this. So if you can keep the sanctity of the sticks and the machine and calibrate it once in a while, you can depend on it. But I don't see anybody doing that in India. They just keep it when they feel like it, they use it. When they panic, they use it. Some people, do it on a weekly basis. Why they do that, I don't know. Because sugar really doesn't matter that much. At the end of 3 months, you see your HbA1c, it is fantastically good. Your sugar glucometer has been showing all wrong values. Do you think I will increase your tablet? Definitely not.
Thank you, sir.
What is the actual fasting and postprandial reading that should be governed by WHO or whichever is the topmost health body?
Very good question. Till 1 month ago, we were telling it should be less than 6. It should be good control. For elderly people, it should be not more than 6.5. Because as you grow older, safety becomes more important than accuracy. Okay, an elderly person may not be eating his food on time. We don't want him to faint. We don't want his fasting sugar to be 70 to 110, which is the defined normal. As you age, the fasting sugar has to be, a doctor will give a leeway of 20 points. He may take it to 100 and keep it safe. That's still normal. It's less than 110. That is one. The other part is last month or so, 2 months before only, they've now done a study to find out as you age, HbA1c also keeps increasing. So the guideline for this will be, I think the tabular column will be released sometime shortly. Then we don't have to go for such strict HbA1c controls for people above 60. And above 80, you got to be really, really careful so that you don't get a gold medal saying, I controlled your sugar and he faints in the night. Okay. You got to have a safety margin. As the age grows up, your safety margin has to grow up. You need to care for that particular person, not the textbook.
Okay.
Can I ask a question, please?
Yes, sir, please.
This is a traditional question regarding, I am a diabetic and I'm also a heart patient.
Yes.
In the coconut and coconut oil, there's so much talk about it. Does it causes cholesterol or not?
Coconut.
Coconut and coconut oil.
Okay, sir. Okay, see, the thing is, in the I forgot which year, the CADI study was done, coronary artery disease in Indians. In Los Angeles, INAS started a center called CADI Center for studying only heart disease, which was booming in NRI Indians. Then only we came to know it was booming in India as well. And in UK also the same thing happened. When they studied the thing, they found a disproportionate high income, number of people in Kerala getting this. So they tied it to high fatty acids. Okay. But generally all over the world, if you see, the tribal people have less heart attacks. The villages have less heart attacks. They also give traditional food. But only in Kerala, you have the highest amount of literacy, worries, job seeking, going abroad, turnover. So what happened in the 60s in the US, when they came out of the 60s depression, there was a industrial boom and heart attacks zoomed in the US. Whereas in India, when this revolution happened in India, if you see the graph, it was equal to that. So they decided that it was high stress and not really the coconut oil that is to be blamed. And moreover, even if you're a heart patient, you're allowed 4 teaspoons of oil per day, essential for the body. One of them can be high density fat, which means it can be Shuddh ghee, or it can be a pure coconut oil without any preservatives and adulteration.
Thank you.
Doctor, can you tell me what is the right fasting for the adult fasting value and the postprandial and random? What is the,
Okay,
where
sir.
for one can check? Because I am not diabetic, but I am a conscious person. So I actually don't know. I keep on seeing various figures that, you add 100 to your age, that is your random should be okay. Somebody says 250 is now the new norm. So what is the present norm?
Not like
which
that. See, if you're a young person with no other complications coexisting in your body, 70 to 110 is the defined normal worldwide. Okay. Now, if you look at your PP sugar, you declare diabetes between 140 and 200. If your fasting sugar is normal, then you may be in the pre-diabetic range. Only after eating it may go up a little bit. That doesn't make you a diabetes. Now, if you take a random sugar and it is consistently above 200, you can start getting, I don't go by random at all. I go only by fasting sugar. The main target for you is to reach a fasting sugar, because whole night you're fasting, and when you get up in the morning, if your doctor has done a good job, your fasting should be in the normal range, because there are no other factors when you're sleeping. So put together, your primary target is 70 to 110 if you're a young person, but as you age, I would even take it up to 120, 100 to 120 for safety's sake. Does that answer your question, sir? Okay, so I can tell you everything in the medical textbook and confuse you, but I'll tell you only one thing, sir. If an elderly person comes into my room, a diabetic for say 10 years, 20 years or whatever, first thing is I need to keep his fasting sugar safe. I don't care too much about his PP sugar. At the end of 3 months, even if sugar is about 200, PP sugar, if HbA1c is normal, who am I to question his stomach? That is point number 1. Point number 2, if you take 24-hour control, your fasting sugar is the biggest target that you can achieve. Now, some people will have after breakfast 1 hour elevation, after lunch 1 hour elevation, after dinner 1 hour elevation. So 3 to 5 hours in 24 hours is really not going to touch your HbA1c. So it's not an engineering game, it's not a number game, it's a human body. So each person you'll have to plan a little bit differently.
Okay. Thank you, doctor. But I think this prelim session is good, and we need to stay in touch. So I will have those numbers, and but the number you have given in the Facebook thing, that number is incorrect. I tried that number. I mentioned in the comments also. That number is not right. That the ending with 62,000.
Sorry, sir. The team will look into it and we'll rectify it as soon as possible.
Sure. Thank you so much.
Hello. So
yes,
I have a question for you.
Please.
I am actually 61 years and I am a pre-diabetic. My fasting sugar normally ranges between 115 to 125, and post lunch is normally 140 to 145.
Sorry, what were you saying, sir? Your fasting is
115 to 125.
115 to 125.
125.
And
my
61.
post 61 and post lunch is almost 140 to 150. And HB1AC I did last time was 6.7.
Sir, if you don't have any other complications, I'll rather keep you off tablets. I'll tell you to enjoy your life as much as you can till one fine day sugar goes beyond a level and I have to put you on tablet. Enjoy your pre-diabetes at the moment, sir. Don't get into medicines. Okay,
I am on tablet for last 4 or 5 years.
Then it's not pre-diabetes, sir.
Trajenta DO.
No. If you are a pre-diabetic, you put a tablet, the patient will faint and go into coma with low sugar. You're a pakka diabetic who has been on tablet for 4 to 5 years. So the definition itself is wrong.
Right.
Good evening, sir.
Yes,
Sir, myself, Darshana Shah, 39 years old, and I just diagnosed with the diabetes, like sugar level was really high around, my HB1AC was 13%. And I came to know when I was under the that investigation for gallbladder removal surgery.
Correct.
So, and it was found with 18 stones when it got removed fully. So might be the reason is this gallbladder for my diabetic, because I don't have any family history.
Okay, see, you're asking a very highly complex question. If
Oh,
you
okay.
had stone and one stone blocked the drainage from the pancreas, because both have the same drain, your gallbladder and your pancreas drain through one duct.
Yeah.
So if your stone in the pith bag went in reverse and blocked out, so your pancreas got swollen, after the surgery and after ruling out every other causes, there is a likelihood your sugar might settle. But
Okay.
sitting here, I shouldn't be talking about all this and guiding you without having the background data.
Correct.
Please go to a, see, for this you need a high level doctor, a senior doctor.
Okay.
So go catch a senior doctor where there is a diabetologist and a gastroenterologist. And
Okay.
between them, they'll tell you whether it's a pancreatic diabetes which can be reversed or it's a long-standing diabetes which surfaced incidentally along with your gallbladder. It was just found like
Fine.
that. So there are multiple possibilities. Please don't take my word for it from distance.
Sure, sir. Sure. Thanks a lot, sir.
Thank you.
Doctor.
Yes. Yes, sir. Please. I think we'll take the last question, sir. Been going on. Please go ahead with your question, sir.
Doctor.
Yeah. Yes, sir. I'm listening. Yes, I'm listening. Please go ahead.
Yeah. I'm actually having a I'm diabetic and having a medicine with tablets along with insulin. But insulin is about like only I take 5 points in the night, but otherwise it's all fine. You think insulin is harmful to the body, or how would you?
Never ever. The body secretes insulin inside your own body.
Okay.
So how can it be harmful?
No. I'm taking insulin like 5 points at the night.
Yeah, but that is a human insulin. It's not taken from another human. It's been remodified to produce human-like insulin is given into the body. When your body is not secreting insulin, see, I'll give you an example, sir, and I'll for your benefit. See, you got 8 horses pulling your carriage. Okay,
correct.
You are a diabetic. It goes on and on and on. After that, 2 horses fall away. 6 horses
correct.
do the job of 8 horses. Then after some time, within about a kilometer, 2 horses drop away. Now 4 horses are doing that of 8 horse job. So within quarter of a kilometer, they drop away. Now 2 horses cannot do the job of 8. So how many?
Correct.
1, 2, 3, 4, 5. You can't go on increasing a tablet till it becomes toxic. So what they do then is they do a test to find out whether any number of tablets put together, insulin is not secreting in your body. Any number of tablets put together, insulin is not secreting in your body. Then they decrease your tablet to keep you safe and replace the Baki with 5 units of insulin. Have you understood that, sir?
Yeah. So it's not, insulin in short is not harmful by taking, right?
I promise you it's not, sir. Used in the right way.
Okay.
It keeps
Doctor.
people alive longer. Babies are born because of insulin. Tablets can't make a baby and mother safe. Surgeries are conducted. Bypass surgeries are done safely in India and all over the world only because of insulin. We win diseases in the ICU because of insulin. Without an insulin, it would have been a nightmare to run an ICU.
Doctor.
Yes, sir.
Okay. Doctor, as diabetic, I've been advised not to put sugar in my coffee and not to eat sweets and not to drink alcohol. If I have sugar in my coffee or by mistake I have a sweet, what will it harm me?
So I'll tell you one thing differently, sir. I don't know whether I should say it in a webinar. Each doctor has got his own style of doing things. The thing is, one patient of mine loves a chocolate. He says, doctor, 15 years I've not touched it. You let me eat this much chocolate. I don't want anything else. There's something called a food substitute compromise. Like I said, you can't go to UK and tell the German guy, you go to Germany and tell the guy, don't drink beer. You cannot go to, and tell them not to eat sausages. You can't go and tell the UK guy not to eat mashed potato. You have to treat according to the diet of that person. So if you like only one small teaspoon of sugar, the easiest thing I tell them is put 1 tablet of sugar free and put 1 teaspoon of sugar. So 1 teaspoon of sugar is 70 calories. Okay. So when you are a diabetic, I suppose for average weight, you should be allowed about 1,500 kilocalories. How will 70 calories upset the whole balance? So first thing I put is emotional security and happiness of my patients. Then only I play the diabetic game to reach a level which they want. There's no point just reading a book and vomiting out sugar is bad, chocolate is bad, and this is bad, and that is bad. Then you're changing the person. He's got one life, he's living happily in his old age. The doctor has to change this treatment plan accordingly. So you'll have to ask your doctor there what can be done. You just need 2 teaspoons of sugar, which is 140 calories. How will it change my entire profile when you're allowing me 1500 calories, doctor? You ask him that one question, he will have a revelation.
Sir,
Thank you.
I have a question. Can I ask you, sir?
Please.
Okay. Sir, I'm 48 years, about to be 49 in a month or so. I was a premature Bobby and I had an atrial septal defect, and there were no complications excepting that 21 years before I was diagnosed with sugar. I did not do exercise to start with. I went on to medicine, etc. Roughly 3 years back.
Let me just clarify one thing. So you did not have any complication that will affect your sugar or your future or your lifestyle. You only had a hole in the heart which was closed, which is a genetic defect. Congenital defect.
Congenital defect, but I started having
that came, that went. That's it. That doesn't affect the rest of your life.
No. The question is not that. I'm just giving some little history. Sorry. Okay. What has happened is in the last 2 years, I became a little conscious of weight. I put in little more than weight. I was more than body mass index was 780 kilos above. Now I'm exactly on the body mass index because every day I walk for 1.5 hours and I definitely seen positive point. Only thing that is affecting me is still, despite my weight loss and possibly little more positivity, I'm not able to control the constipation part. That is still coming on and off for me. If there is a little stress, the constipation is more due to work, but I'm seeing that alone is possibly an effect of me because of diabetes or something. Maybe I'm
No. Yeah. The constipation could be because you're a high-strung person. Okay, IT, finance, trade, staying up at night. A whole lot of jobs today are throwing up constipation as a lifestyle problem. Okay, you can also have diabetes, which causes neuropathy, which means the gut is not getting a signal to pass urine. To pass motion. You can also have a gut pathology. So it's not engineering. It's not 1 + 1 is equal to 2. The same tablet I give to 5 people, the 4 people will be all right. One might get a reaction. Each body is different. So you please go see your doctor. First, go through your family doctor. They'll give a fair idea of what to do. And with those tests, meet a specialist and find a solution. Okay, the solution may be in a wellness program. The solution may be in lifestyle modification. You don't have to use high medicines immediately. But the answer may be in that if you have a gut pathology. So you cannot guess it from here, sir.
Okay, thank you.
Thank you. Thank you very much for your time. I hope I could share a little bit of my thoughts and help you in any small way. Thank you all very much for your patience.